Assalamu alaikum and welcome. Today we are going to start our lecture number 2. We were doing the root enteral root, and now we are heading towards the parenteral root. The parenteral root. Now, what were the we will study the main points. The parenteral drug enters directly into the systemic circulation. Parenteral administration is mainly used for those drugs which are poorly absorbed from GI tract, for which we have to bypass the absorption process in IV, or some unstable in GI tract, those drugs. For example, insulin. Parenteral administration is used for the patient who are unable to take oral medication, such as the patients who are unconscious and where we require rapid onset of actions, especially in emergency cases. Now we are going to study the parenteral routes. Mainly there is an IV injection, ID injection, intradermal. This is the layer of the skin. The lowest part is the muscle, and then there is a subcutaneous layer, dermis layer, and epidermis. Subcutaneous injection, which goes below the dermis layer. IM injection, it is directly inserted at a 90-degree angle, and IV injection, which goes directly into the bloodstream, and this bypasses the absorption process. The rest of the injection, there is the stage of absorption. Now here you can see this is the plasma concentration curve. An IM injection of midazolam for 5 mg and IV. The IV concentration immediately reaches the peak. It may be just 5 minutes, whereas the IM injection gradually increases the concentration and then gradually decreases, and it requires time because there is a process called absorption. Now these are the 4 routes. First, the IV route. This is the most common parenteral route, where the drugs are not absorbed orally, such as rocuronium. It provides a rapid effect, maximum degree of control over the amount of drug delivered. When you inject a bolus, the full amount of the drug is delivered into the systemic circulation. For IM injection, it can be an aqueous solution as well. These are absorbed rapidly. Now, depot preparations often consist of suspension of drug in non-aqueous vehicles such as polyethylene glycol. Subcutaneous injections are absorption via simple diffusion. These two, IM and SC, are slower than the IV route. These injections minimizes the risk of hemolysis or thrombosis, which are associated with IV injection. Intradermal, it is injected directly into the dermis. Now some other preparations are oral inhalation and nasal. These also provide rapid delivery of the drug across the mucous membrane of respiratory tract and pulmonary epithelium. Drugs that are gases, for example anesthetics, and those that can be dispersed in an aerosol, these are administered through oral inhalation. This route is effective and convenient for patients with respiratory disorders such as asthma and COPD. Drugs are delivered directly to the site of action. The nasal route involves topical administration of drug directly into the nose. Now, intrathecal or intraventricular. The blood-brain barrier typically delays or prevents the absorption of the drug into the CNS. So, we require intrathecal or intraventricular when we have to bypass this barrier, blood-brain barrier. Topical, when we require a local effect. Transdermal, this achieves a systemic effect by the application of drug to the skin via the patch. We can see here there is a patch. Now, this is the skin, these are the layers, and this is the patch, and this is the drug reservoir where the patch is holding the drug. This is absorbed slowly through the layers of the skin directly into the blood vessel. Drug is diffusing from the reservoir into the subcutaneous tissue. The patch is simply as shown in the diagram. Now, rectal route. Now, because 50% of the drainage of the rectal region bypasses the portal circulation, the biotransformation of the drugs by the liver is minimized through this administration. You can prevent the GI environment. This route is useful if the drug induces vomiting. Okay, when given orally, the patient is already vomiting or the patient is unconscious. Now, this is a table for all the route of administration. We have gone through its absorption pattern, its advantages, disadvantages, and the examples.